Good day, everyone. Welcome to our newest topic that will surely give you knowledge on how to properly take good care of your most precious wealth, which is your health. Let us now begin our health to health talk that has something to do with the deficiency of one of the essential vitamins needed by each individual's body to function well. Let us start the discussion by giving a simple description about the illness that we are going to talk about. First thing first, the word beriberi means I can't in Sinhalese, which reflects the crippling effect it has on its victims. Beriberi is a disease caused by a lack of vitamin B1 or the thiamine in the body. Thiamine normally plays an essential role as a coenzyme in the metabolism of carbohydrates. In its absence, pyruvic acid and lactic acid, products of carbohydrate digestion, accumulate in the tissues, where they are believed to be responsible for most of the neurological and cardiac manifestations. Although beriberi can occur in anyone who is poorly nourished, it is very rare in the United States due to the addition of vitamins to many of the foods we eat. Common in Asia, where white rice is the main food, thiamine occurs widely in food but may be lost in the course of processing, particularly in the milling of grains. In the United States, beriberi is primarily seen in people with chronic alcoholism. Beriberi generally affects the nervous system and the cardiovascular system. Dry beriberi. Thiamine deficiency with nervous system involvement is termed dry beriberi, characterized principally by peripheral neuropathy, or the symmetrical impairment of sensory, motor, and reflex functions of the extremities, especially in the distal lower limbs. Muscle become wasted and weak, difficult walking, patient become bedridden, and may die. This usually occurs when poor caloric intake and relative physical inactivity are present. Another presentation of neurologic involvement is Wernicke-Korsakoff syndrome. It is a brain disorder caused by thiamine deficiency that results in a number of neurologic symptoms and can be lead to psychosis, confusion, and hallucinations. Improvement can be achieved at any stage by the addition of thiamine. Only half of the patients treated at this stage recover significantly. Wet beriberi. Wet beriberi affects the heart and it causes combinations of heart failure and weakening of the capillary walls. Evidence includes peripheral edema, swelling of the lower legs, increased heart rate, and shortness of breath with activity. These changes can lead to myocardial injury expressed as chest pain.
What causes beriberi? Who is at risk? And what are the symptoms of it? First, let's talk about the causes of beriberi. Beriberi is a disease caused by a lack of vitamin B1 or what we call thiamine in the body. It can occur in anyone who is poorly nourished. The most common cause of beriberi is alcoholism. Drinking heavily can lead to poor nutrition, and excess alcohol makes it harder for the body to absorb and store thiamine, which leads to deficiency. There is also a rare condition known as genetic beriberi, which is inherited or passed down through families. People with genetic beriberi lose their ability to absorb thiamine from foods. This can happen slowly over time and symptoms occur when the person is an adult. However, because doctors may not consider beriberi in non-alcoholics, this diagnosis is often missed. Beriberi can also be occur in breastfed infants when the mother's body is lacking thiamine. The condition can also affect infants who are fed unusual formulas that don't have enough thiamine. Getting dialysis and taking high doses of diuretics raise your risk of beriberi. Prolonged diarrhea can also make it difficult for your body to absorb vitamin B1. And some diseases like liver disease impair your body's ability to use vitamin B1. Let us now move to the symptoms of beriberi. The symptoms of beriberi vary depending on the type, wet or dry. Symptoms under wet beriberi includes the following: shortness of breath during physical activity, rapid heart rate, swollen lower legs, and waking up at night short of breath. While symptoms under dry beriberi includes the following: tingling or loss of feeling in the feet and hands, muscle pain, mental confusion, difficulty in speaking, vomiting, involuntary eye movement, difficulty in walking, and loss of muscle function or paralysis of the lower legs.
Complication. The heart failure of beriberi, if untreated, can be fatal. Anaphylaxis can result from parenteral treatment. Thiamine deficiency may occur with deficiencies of other B group vitamins which may need treatment in their own right. Korsakoff syndrome is considered more fully elsewhere. The essential features are anterograde and retrograde amnesia, often with disorientation and confabulation. The last usually makes the patient delightful, but any check of authenticity of stores will reveal them as confabulation. Wernicke encephalopathy is also covered elsewhere. Patients are often apathetic and confused. There is ataxia and nystagmus, and even coma may result. Treatment of beriberi. Beriberi is treated with thiamine supplements. Your doctor might prescribe a thiamine shot or pill. Monitoring your progress is usually done with follow-up blood tests that show how well your body is absorbing the vitamin. Your doctor may also put you on a specific diet of a thiamine-enriched foods, including whole grains, eggs, meats, beets, nuts, seeds, and tomato or orange juice. Foods such as mild rice, shrimp, and raw meat make it harder for your absorb to vitamin B1 and might needed to be limited.
Prevention of beriberi. Naturally, the prevention of beriberi consists of providing sufficient amounts of thiamine through diet and vitamin supplements. Thiamine or vitamin B1 can be found as an individual supplement or as a part of the B-complex vitamin supplement. Doctors usually recommend taking other vitamin supplements along with thiamine. However, it is much better to take the vitamins the natural way, through diet. Thiamine can be found in small amounts in many food sources. This vitamin is also found in cereals, particularly in whole grain ones, much more than in refined ones. Other food sources include flax seeds, oatmeal, sunflower seeds, brown rice, potatoes, cauliflower, oranges, eggs and beef. People who have recently been ill, who exercise vigorously, or strain the body in any way, as well as those who drink heavily, are advised to increase their intake of thiamine-rich foods and to consider taking thiamine or B-complex supplements.
Beriberi, as other vitamin deficiencies, is a serious condition that should be treated promptly. Delayed treatment of beriberi may result in permanent complications or death. If you exhibit symptoms of beriberi or feel that your diet may be providing inadequate amounts of thiamine, seek promptly medical care.
Hope that you learned a lot from our health talk for this day. Have a nice day, everyone!